On any given day, any of us could have a medical emergency where our health or even our lives are on the line. In those moments, decisions matter: where you go and who you trust with your health or that of a loved one. We honor that trust at the University of Kansas Hospital with our commitment to be the most qualified source in the region for time-critical care. Severely injured trauma victims have a 25% greater chance of survival if they're taken to a Level 1 trauma center, like the University of Kansas Hospital, the only nationally verified Level 1 trauma center in the region.
One thing that sets us apart is that we have in-house trauma surgeons who are both boarded in trauma and surgical critical care. They're here 24/7, in-house night and day. The other thing we have is specialists in neurosurgery, orthopedic trauma, trauma urology, many other specialties.
If it's what we deem a type 1 unstable trauma, which is our highest level of trauma, we will have an ED staff member who's there to view that patient and to make sure that they don't need an airway or some kind of intervention to help them breathe. We've got 2 nurses at the bedside. We've got a tech, an EMS provider, a blood bank person. We operate like a symphony. Everyone has a role.
Each year, almost 250,000 Americans experience STEMI, an ST elevation myocardial infarction, the deadliest form of heart attack.
The majority of the heart damage is done within the first hour of the onset of a heart attack, so you need to act quickly.
Call 911 so that an ambulance crew can evaluate you and alert the nearest hospital that you're on your way.
For many years now, cardiologists and heart hospitals have concentrated on shortening the time from presentation of the patient at our door into the cath lab and opening up blocked arteries, and we call that the door-to-balloon time. The national standard is 90 minutes. We've met or exceeded that for a number of years now, and we're constantly looking at better ways, more efficient ways to treat the patient so that we can shorten that number.
That's part of why outcomes for heart attack patients at the University of Kansas Hospital exceed the top 10% of hospitals nationally, and why it's ranked among top hospitals in cardiology in U.S. News and World Report. In the United States, someone suffers from a stroke every 45 seconds. In this region, the University of Kansas Hospital offers the leading stroke care program.
Approximately 2 million neurons or brain cells die per minute when somebody's having an ischemic stroke. Proper care and quick evaluation of stroke patients can potentially reverse or lessen stroke symptoms.
We have 24/7 availability of neurologists, neurosurgeons, neurointensive care providers, and the most advanced neuroscience nursing really available.
This team includes surgeons who have obtained advanced specialization.
My specialty is working inside the blood vessels inside the head to remove the clot. With my specialty, we have a huge number of techniques and tools that are available here at this institution that may not be widely available. There is no part of the brain or blood vessels in the brain that we can't get to or haven't treated with a stroke.
When I think of my family member having a stroke, I think I want them to go where they know what they're doing, and they do this every day.
The University of Kansas Hospital is the region's only burn care facility accredited by the American Burn Association and American College of Surgeons.
We have hydrotherapy for taking care of burns and dressings. We have dedicated ICUs and a dedicated OR, which is pretty unique.
We see these patients every day. It is our specialty, and that's what allows us to have that increased and advanced knowledge and really provide that best care for the burn patient.
We're very good about getting them through their hospital stay, but that's not where burn care ends. We follow these patients throughout their lives, even for months, years to come, to make sure that they're able to go back to functioning in the community and their life.
Our main goal is ensuring that burn victims become burn survivors.
No one can predict a medical emergency, but we can do our best to prepare for one. And knowing where to find the best care in the region is an important first step. The University of Kansas Hospital. Why would you go anywhere else?